All right, welcome everybody. Today, what we're going to be doing is going over the script. This is going to be the main script that you're going to use when you're talking to someone about health insurance. It is a cross-offering script, basically meaning that it has enough questions in it where if you want to do life insurance during the call, you can do that. If you want to find out if there's any opportunities for annuities, you can do that. If you want to see about offering dental, vision, any supplement plans, you'll be able to do all of that with this one script. So it is very broad. My advice when you're using this script is to kind of internalize it, look at the way that it flows, look at the questions that you're asking. That's the most important part. After that, you can change it to make it sound like you, but you're going to want to make sure that you're asking these questions so that you can make sure that you don't miss out on any opportunities to help the client in a bigger way rather than just signing them up for one of the ACA plans and then moving on. So I'm going to go through it pretty much just step by step here. All right, so hey, Mr. Smith, I'm Ian Sanders. I'm just getting back to you about the health insurance you were looking into. It looks like you put your zip code here as 85040 and your date of birth is 8/16/1975. Is that correct? Now, the reason that I do that is to make sure that I give some degree of credibility at the very beginning of the call. I want to make sure that the person, trust me, they understand that I'm giving them a call because they submitted information to me. So that opening is going to primarily be used when you're calling someone out of the not out of the blue, but you're going to use that opening primarily when you're calling a lead that you've got from some type of lead system. So had somebody contact you from LinkedIn or had somebody contact you through YouTube, or it's a warm market person or anything like that. You're not going to use it for that. What you're going to use it for is if you went and bought a lead, for instance, with somebody that was interested in health insurance and gave them a call, then you would say something like that. All right, great. So I'm assigned to your request. We do everything virtually, and this will only take about 10 minutes. Grab a pen and paper. I have a couple of things for you to write down. If they don't have a pen and paper, you would then just go ahead and text them the name and license number. The reason you're doing this again is so that you can give them that credibility, that ease of mind, because they're going to be giving you a lot of information. And if you give them information first, they're a lot more likely to give you the information that you're asking for. So again, first thing I want you to do is write down my name. It's Ian Sanders. Next is my license number, 8771933. The state requires me to leave that with you, so you can look me up if you want to on the Department of Insurance website, or give them a call so you know who I am. I'm assigned to your request so you can save my name and number. That way, they now feel like they're connected with you. They have all the information on you that they'll need. They may ask for additional information down the road. That's why it's good to have a website with your license and your picture and all of that on line as well, so you can give that to them. But this usually works out just fine. So now the way this works is very simple. I'm a licensed broker, so I'm like your personal shopper, and I take a holistic approach. What this means for you is that since I have access to about 30 different companies, my job is just to ask questions, find out what you're looking for and can qualify for, and to try to get you the most complete coverage possible that's within budget. That sound good? Great. So what you're doing is taking away a lot of the objections that the person's going to have, because they may want to look around, but you're able to do that. No one can look around better than you are. You're a broker, so what you're going to do is do your job and try to find the best deal for the client within the confines of what they say that they're looking for and what their budget is. And then you're also assuring them that you're not going to try to get as much out of them as you can. But really the goal with everyone here, especially here with Oasis, if you're on my team, is to make sure that you can get them the most coverage possible within their budget or even under budget. So to start out, I'm going to ask you a few questions to get an idea of what you're looking for specifically. After that, I'll do some research for you and come back with a plan for you. It may take about an hour to do the application. What works best for you? Monday or Tuesday noon, I have 2 o'clock and 4 o'clock available if they're picking the afternoon time. So that's more if you're going to set a follow-up appointment, as if you're so basically what you would do this for is if you're not comfortable yet just going straight through and enrolling someone in a plan on that first call. This will usually happen maybe your first 10 enrollments or so. You'll want to get all the information, do the research, times, and then go back and present it to them. But once you really get it down, you'll just completely skip this part. You'll just say that you have a few questions to get an idea of what they're looking for specifically, and then you'll jump into the questions. But if you do need to set up an appointment, you're going to want to do that before you get started, just because it's easier. All right, so the next question, were you looking for coverage for just yourself, or was it for you and the family? They'll answer that. How many people need coverage? What are their ages? Put that into Health Sherpa. What's your expected income? Now, this is if they're self-employed, it's going to be their line, not, excuse me, it's going to be their line 11. I always have problems with that. On their tax return, their adjusted gross income, their taxable income, that's what you're going to want to find out. And what you may have to coach them with on this is not over exaggerating how much money they make. Like if they have a job and they make $70,000 per year, that's not going to be their adjusted gross income. We need to know what it is after deductions and things like that. If they're self-employed, especially, they may say, yeah, I make $150,000 a year, but with expenses and things like that, it may be closer to 80,000, which is going to work out in their favor for the subsidies. So you want to make sure that you're asking those types of questions and that you're digging a little bit further, because sometimes you can lose a client all because you didn't ask the right questions. And now they're saying, wait, this is way too expensive. I heard that I can get it for X, Y, and Z, which is true. You just didn't ask the right questions to get them there. All right, so do you currently have any health or life insurance coverage? If they say yes, get the details. If it's through their company, you would ask, what's the size of the company? What do you like about the plan? So you can get a feel for what their likes and dislikes are, because what you really want to be doing is making sure that you're doing what's right by your client. And the way you do that is by figuring out what they currently have, what they like about the plan that they have, what they dislike about the plan that they have. And then that's the C question here. What don't you like about your plan? Now, if you had to choose between these different types of coverage, which would you prefer? An expensive plan that covers everything, or a plan that costs less, but you pay more only if something happens? The reason that's important is because it kind of primes them to know that, hey, I'm going to have to pay more if I want more benefits. If I want money, I understand that it's not going to cover as much, and I'm going to have to pay more if something happens. You don't want to leave them with any surprises. Next, have you or anyone that is going to be covered been diagnosed, treated for, or taken any medications for the following conditions: heart attack, stroke, TIA, cancer, diabetes, neuropathy, ALS or Lou Gehrig's disease, high blood pressure, high cholesterol, and just anybody use tobacco? The reason you're doing that is to see if there is a supplement that they would be able to qualify for, because you want to make sure you can offer those. But if they have some of these, they won't qualify. And then you also want to find out what their height and weight is. So, and what's everyone's height and weight. That way you can do that. It also gets you set up if in case you want to offer life insurance that has living benefits or transition into something later on, you have all that information already. And it's a lot easier to get as you're questioning part before you start offering things. All right, so are you more concerned about doctor's visits and illnesses, or major things like cancer, heart attacks, strokes, and major accidents? So now you're getting more information about what types of things that they're worried about. How many times do you see the doctor per year? How many and what medications do you currently take? So you're trying to gather as much information as you can to get a real feel for their health, the way that they're going to use the plan. Do you have anything in place to help pay the bills if you're unable to work due to serious illness or injury? That's going to be important, especially if you want to offer a supplement down the road, or maybe they need not a long-term care plan, but a short-term disability plan or something like that. You want to get a real feel, because again, we take a holistic approach here. We want to make sure that we're asking all the questions, sure that each person is covered as fully as possible within their budget. All right, and then do you have a primary care physician? And are you willing to switch doctors if it will save you money? So some people have doctors that they absolutely can't leave. You'll want to know that in advance, rather than offer something, look and see that they're not covered, and now you're in a battle trying to find something that works for them, or they just flat out hang up on you. So this is a good way to let them know that you do care about their doctors as well. Now, if there was an emergency, do you have anything to pull from to help cover costs? These things are like 401ks, IRAs, mutual funds, money markets, or significant savings. The reason for this is about health insurance. They don't think about the fact that if they get sick, they may not be able to work. If they're unable to work, they're not going to be able to pay bills. And so you want to find out if they have anything in place for them to pull from. And if not, talk to them about that and let them know that there are plans available out there where if they get sick, they can pull money from those to help cover those costs. Now, currently, after bills and expenses, what do you feel you have left over at the end of the month? Now, the reason for this question, of course, is to figure out what their budget is, how much they can afford to their health insurance, and then if anything's going to be left over, to include things like life insurance, supplement plans to help beef up their insurance plan as you're putting those things together. Now, of that, about how much are you able to spend on health insurance? A range is fine to give me an idea of what to look for. All right, great. So I have a good idea of what to look for. I'll put together a comprehensive plan and we can go over it on, and then you'll just tell them the time that you said at the beginning. And I'll make sure I send a reminder. When we go over it, we may have some follow up questions and we can make tweaks to it to make sure that it fits. After that, I'll help you submit the applications needed and get you and your family protected. Make sure so you know it's me when I call, okay? So now you're locking it in. They know that you're going to talk about it. You're not necessarily going to sell them something, but now it's going to be a conversation between the two of you so that you can make sure that the plan that you pick out for them actually fits them in their family situation. All right, so now when you're going back and talking to them, the way that this presentation is going to go is you're going to review the things that they said in the previous conversation. So you want to make sure you take lots of notes while you're talking to them. You'll explain how the plan that you put together fits their individual needs. And then you'll ask them, do they have any other concerns or anything else that the plan that you put together for them doesn't meet? And that way you can meet any objections ahead of time before saying, okay, let's go ahead and start the application. All right, so hey, Mr. and Mrs. Smith, this is Ian, and I was able to put a great plan together for you based on what we talked about in our last conversation. Do you have that pen and paper handy? Because I want you to write a few things down as we go through it. All right, so then you say, so first you said that you wanted to, and then you go over the options, they with a low copay, a low co-insurance if possible, that had doctor copays, but you weren't so much worried about those. You were more worried about the bigger things. And then you go through. And so there is a video about using Health Sherpa, and it goes through how to present the deductibles, copays, co-insurance, prescription costs. There's also going to be one about the supplemental coverage and how to go through that and how to put all of that together. So we're not going to go through that right now, but this does outline the fact that you need to go over the deductible, the copays, the co-insurance, the prescription costs, and then any supplemental coverage and how it fills the gaps of the major medical coverage. And then it's a simple question. All right, Mr. Smith, was there anything else you wanted to cover in this plan that we didn't go over? If yes, go over that coverage and add coverage to it if you need to. If no, go over the cost. All right, so perfect. So you said that you could afford to spend, let's say it's $300 a month to cover your insurance. Right now we're at $250. Does that sound good? Yes, 250 sounds awesome. Perfect. All right, great. So I want you to write down the individual policies that are part of this plan. What I have them do is I name each company and the type of plan and write them down. I give them the cost of each plan, and then I explain that we'll be doing the applications for each plan, starting with the major medical, and then we go through the process of how that works. So normally the way that I do that is I tell them, okay, we're going to go through the major medical, and at the same time, we're also going to apply for the supplemental. So I'll be asking you a few questions. It may take a little bit longer, but it does work faster in the long run if I'm doing this all at the same time. This is a lot easier, guys, if you have two screens. If you don't have two screens, I do recommend going one by one, but you'll want to make sure that you're taking notes in a notepad or something so that you can just transfer that information over to the new application quickly. Of course, for HIPAA reasons, you want to make sure you delete that right after the call is done. Don't keep any personal information for any reason. Again, if you have any questions whatsoever, feel free to drop a comment. You can message me directly. I'll be more than happy to answer any questions that you might have. Have a great rest of your day.